Hi everyone. I haven't logged in for a few weeks. Logged in. Hope that's the right phrase to use. But yeah, we've had some changes. So my counts are now um, my epithelial counts are 10 and my white pus cells are 0. So 0 meaning that's the actual infection, which is great, really great cell count. However, I'm still experiencing some symptoms. Not so bad as a few weeks ago. I'm not all tearful and crying and all of that carry on like I was a few weeks ago and feeling sorry for myself. Um, However, I'm still getting increased frequency at night. Not too bad. It's gone right down actually to about 3, 4 times a night. But I'm thinking sometimes it can be elevated by anxiety. So if I've got something quite important on the next day, my anxiety can flare it up. So this is of real interest to me, and I think therefore, combined with this antibiotic treatment, I need to treat this holistically. So I have started counselling. I've had 4 sessions, and I'm going to be looking at working on some trauma that I've experienced in my past. Um, so I'm really pleased about that. And like I was saying in my earlier videos, I think mindset to this is really powerful and important to healing. Another thing that I'm looking at, all of this is costing a lot of money, of course, is I'm going to see a pelvic floor physiotherapist, a female, um, because I do a lot of weight training. I do a lot of kind of compound lifts, squats, deadlifting, hip thrusts, um, because I love weightlifting. And even when I'm in a lot of pain, when I exercise, it, I don't know, it relieves the pain for a short while. And it's just always helped me through this condition is to exercise. So I'm not prepared to stop that, but I am prepared to modify some of the exercises that I'm doing. So, for example, I had a hip injury about 3 years ago, which I think is quite interesting because I pulled my hip in several places from running quite extensively every week. And I then had, I went to see an osteo, and it healed with lots of kind of stretching and things like that, and actual hands-on manual manipulation and all of that from the osteopath. So I'm thinking maybe this UTI could be, I don't know, maybe there's a bit of a mechanical element there as to my pain, and it's not just all embedded UTI, because at the end of the day, I've been on antibiotics for 2.5 years now. So this is a long time to be in treatment. If you think of somebody with cancer, if they have radiotherapy, or I don't know whatever kind of therapy they have, it's normally for a very intensive period of time, maybe 6 months. I'm not too sure, but 2.5 years, is a long time of high strength antibiotics. So I kind of put this forward to Professor and said, look, I'm not really feeling much better. My counts are good, but can I not swap my antibiotic? And he was actually of the viewpoint that because my counts are so good, that it wouldn't be clinically the right thing to do to swap the antibiotic. But what he did suggest is that I come off the antibiotics and have a break, to see if I actually need them or not. When he first suggested that, I was really, really anxious. So anxious that I thought, I don't think I can do that. And then I went on to one of the UTI groups that I'm on and kind of shared his feedback with them. And they said to me that a really nice lady, I can't remember her name, she said, well, maybe, you know, professors described it to me before that the body can perhaps heal itself, and you're giving the body a chance for the immune system to kick in to heal itself, to fight the infection. And what professor was saying was that, you know, you've got, the patient has to see a justification for the antibiotic and feel that justification. So what he suggested doing is weaning off one antibiotic first, very gradually. If there's no symptoms for 3 weeks, then weaning off the other antibiotic that I'm on, and then seeing how I am. But if I start to flare quite significantly, then I can just resume back to my treatment as it was prescribed before with my antibiotics. So that's what I'm currently doing, folks. I am doing that. I started reducing the clarithromycin as of Saturday. I didn't have anything until Wednesday night. I had one dose, and then yeah, I'm feeling, fingers crossed. I'll put this video out now, and I'll go to pot, so to speak. But I'm feeling all right. I'm not feeling much of an exacerbation down there. So one thing that I am taking at the minute that helped me before, at one point in my life, before I found Professor, is, I think I mentioned it before, is Propolis. So as it says, Propolis is collected by bees from plants to defend their hive from infection. So this is a concentrated propolis extract equivalent to 1,000 milligrams. So I'm using this, folks, because I used this initially several years ago. This was before I had any investigations and everything, and it seemed to help me. It seemed to really help with my frequency and pain. So it did help, and then I had all of these investigations, the cytoscopy, an intravaginal scan and all of that, which come up with nothing, urodynamics, that come up with nothing, and it all come back, all my symptoms come back. So I don't know whether or not this was a new emerging infection, or whether or not it just kind of exacerbated the existing infection there. So yeah, that's where I'm at the minute. Fingers crossed. I'm hoping that, I just want to come off antibiotics, to be honest, because I just want to really give my body a chance to recover. And with that thought in mind, I think this woman, what she was saying on the group was that when you then say go back to antibiotics, your body might respond a bit more efficiently to the antibiotic. I mean, this is the theory. I just think with this condition, though, it needs a holistic approach. It's multifaceted. There is not one treatment option for everybody. Some people heal from this condition from herbal supplements, Chinese herbal medicine, pelvic floor physio, antibiotics. So what I'm trying to do is combine everything. I'm not going to look at herbs. Apart from this isn't really a herb, but it's a supplement. But I found with herbs before, they make me worse. They make my frequency really bad, my urgency really bad, and I don't really find them to be effective. And also, I think I'm a person that loves herbal remedies and things, but I think I get carried away. I've got carried away before. I've taken loads of herbal supplements all at once, and they've all conflicted with each other. So I think the best approach is to trial one at a time. So yeah, that's what I'm doing with this. So yeah, fingers crossed. Let's see what happens. I'm really hopeful. I'm meant to be going away soon as well, so that is causing me a little bit of anxiety at the back of my head. But I've got to live my life at the end of the day, whether that be in pain or not in pain. And it takes a lot of willpower and it's tiring. I don't sleep very much at night, but this is temporary. This is all temporary, and some people just recover without any intervention after a number of years of being on antibiotic therapy. They recover. It's kind of like your body naturally will heal itself. So that's what I'm hoping my body will do. Fingers crossed. Okay, thank you very much for listening and tuning in. Speak soon. If you've got any questions, please put them at the bottom of this video, and I'll tune in with you guys again soon. Please hit like and subscribe. Okay, bye.